The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to the Patient Talks. On this week's episode, we're going to be discussing hernias, what that is, the more common ones that we see, and a look-alike that you're actually able to treat on your own at home. A hernia in general is where a part of tissue or organ has pushed through an abnormal opening. There are several different examples of that we see commonly in our clinic. Hiatal hernias are very common, ventral wall/umbilical wall hernias, and inguinal hernias. Patients tend to have a general understanding of what those are, but I thought I'd give you a much better physiological understanding of what's happening with each one of these. Let's start with a hiatal hernia. What a hiatal hernia is where part of the stomach has gotten up above the diaphragm and is now within the chest wall. And it actually makes a lot of sense if you think about it as far as what has happened. So your esophagus obviously is here. It goes down and you know about where your stomach is. Between those two is the diaphragm, that thick membranous muscle that goes up and down, which allows your lungs to expand and contract. Well, the esophagus, in order to get to the stomach, has to punch through that diaphragm. And what can happen is, basically, if you imagine a pipe going through a sheet of metal, there's a little weakness right where that weld occurs. And what can happen is the stomach can punch up through that area and be up in the chest wall, a section of it. The most common type of that is what's known as a sliding type hiatal hernia. And what that is where the stomach will sometimes make a section of it up into the chest wall, part of it slides back down and back and forth. One of the most common causes of hiatal hernias is what we call increased intra-abdominal pressure. And frankly, that's a nice way of saying you're carrying extra weight. And that extra tissue within the stomach increases abdominal pressure, which helps push that stomach up. One of the home treatments for it is to help lose some weight. A lot of times we simply use antacids as well, or proton pump inhibitors. If it is truly severe, there are surgical corrections for a hiatal hernia, but that tends to be for the patients that have really severe symptoms that just aren't responding to treatment. The next one up is inguinal hernias. This one is usually associated with men, but it can happen in women as well. The reason men are more susceptible to an inguinal hernia is so during development, the testicles actually form up in the abdominal cavity. And then somewhere close to delivery, they actually descend through a couple of channels and drop into the scrotum, and that channel walls off. But just like I was talking about on a hiatal hernia, where that former channel was is a potential area of weakness. And what can happen is that channel ends up popping back open due to increased abdominal pressure, and tissue can follow that channel down into either just the suprapubic area or all the way down into the testicles. On an inguinal hernia, there's three different things to watch out for. So the most common one is what's called an easily reducible hernia. That means you can feel the bulge, but when you push on it, you can drop it right back in. The next level is one that's called an incarcerated hernia. And this is where that material that has fallen down into that channel can't get back out. It's stuck. And then the third one is a medical emergency, and this is called a strangulated hernia. And that's where that tissue has fallen through that channel, but now the blood supply to that section that had dropped in is getting clamped off. And if you imagine just running something around your finger to cut off blood supply, after a while, you're going to lose your finger. So usually with an incarcerated hernia, there is substantial pain and you are ill. In that event, directly to the emergency room quickly. An incarcerated hernia does run a significant risk of developing into a strangulated hernia, so that is almost always a surgical correction. Now, on an easily reducible hernia, typically surgery is recommended as well because those, frankly, tend to get larger over time. And lastly is a ventral wall hernia. So what that is, the front of your stomach is the ventral wall. If you imagine someone who has a six-pack, so you have those set of abdominal muscles, there's a line right down the middle, and that's a potential point of weakness. And in a ventral wall hernia, in that area, part of the underlying abdominal tissues are able to push through that material and end up with a bulge in the front. An umbilical hernia is considered a subset of a ventral wall hernia. Again, it makes sense. There used to be a tube that went through where your belly button is. That's always a potential area of weakness. With an umbilical hernia, obviously you have a little bulge where your belly button should be. Sometimes it's small enough it doesn't really cause any issues. Sometimes it's large enough to be unsightly but not dangerous. And other times there is the potential of incarceration or strangulation like we talked about on an inguinal hernia. And lastly, we have the lookalike. This is one called diastasis recti, and it can look very, very similar to a ventral wall hernia. I've been fooled on this one several times myself. So you go back to the six-pack of abdominal muscles and you have that line between them where there isn't any musculature. Well, it's very common in pregnancy and frankly even in guys who have put on a lot of weight suddenly, those abdominal muscles start to spread. And while there has not been a weakness that is punched through that connective tissue, it is spread out enough that you can see it bulge in that area. And that's called a diastasis recti. These typically do not need surgical correction. Matter of fact, most of the time, it is contraindicated to do surgery on these. Instead, this is one that can be treated through certain exercises. However, I'll tell you, the ones that you would assume would help actually are the ones you don't want to do. On diastasis recti, we don't recommend crunches, we don't recommend planks, push-ups, things of that nature that really cause those abdominal muscles to push out. Instead, there's some very specific exercises that kind of help close that area in. That's one well worth talking to your clinician about. He may also refer you to physical therapy to help treat it. But this is a treatment, or this is a problem that can be treated at home. So that's hernias. I hope you've enjoyed the show. If you have, please click the like and subscribe button down below. If you think there's someone else that needs to see this, hit that share button. Next time I come back, it'll be Wellness Week, and we're going to be discussing stress. Until then, get better, make me look good.